Hi there, my name is Dr. Iltefat Hamzavi. I'm a clinical scientist and dermatologist working in Michigan with a special focus on pigmentary disorders. I work at Hamzavi Dermatology Specialists and the Henry Ford Health System. I also serve on the board of the Global Vitiligo Foundation. I manage patients who have vitiligo, which is an autoimmune disease that is caused by a loss of melanin, a pigment found in the skin. The lack of melanin in vitiligo leads to a non-scaly, chalky white patch called depigmented lesions. Vitiligo is often mistakenly thought of as a cosmetic condition, but it can have a substantial impact on patients and reduce their quality of life. It is important to recognize that vitiligo can affect patients of all ages and ethnicities, and they may experience psychological and social burdens, as well as stigmatization and problems with work or school. Today, I'm going to briefly talk about the different ways patients' quality of life can be affected and the factors that may make the impact worse. The psychological burden of vitiligo can be significant. Patients experience issues with self-esteem and confidence due to the visible nature of the disease. These experiences can lead to mental health challenges such as anxiety and depression. Social stigma and isolation are common, as people with vitiligo may feel self-conscious or be subjected to negative comments and discrimination. Choosing which clothes to wear each day can also be stressful, and almost 60% of patients report frequently concealing their vitiligo with makeup or clothing. Other common emotions felt by patients with vitiligo include insecurity, shame, sadness, and fear that their disease could spread. As a result, vitiligo can impact many quality of life factors, such as social activities, work, or school, and lead to difficulties in relationships. The visibility and location of vitiligo lesions may also have a significant effect on the quality of life burden experienced by patients. Patients with lesions on visible areas, such as hands and face, and sensitive areas, such as the genitals, experience an increased burden. Similarly, those with extensive lesions may be more likely to experience a quality of life burden, which can impact daily activities and interactions. The extent of vitiligo may be correlated to disease burden felt by patients. For example, those with more than 25% of their body covered in vitiligo lesions report a greater emotional impact. Participation in leisure activities can also be affected by vitiligo, as patients may avoid hobbies that expose their skin, such as playing sports. The psychosocial effect of vitiligo varies among different populations. Age plays a role, with adolescents facing a particularly high quality of life burden, which can have long-lasting effects on their self-esteem. Adolescents with extensive vitiligo are more likely to experience bullying or teasing and difficulties with friends and schoolwork. The impact of vitiligo can also extend to their parents or caregivers, as they may experience emotional distress due to their child's vitiligo. Adults with vitiligo may struggle with personal and professional relationships. The majority of patients with vitiligo report anxiety and embarrassment when meeting strangers or beginning a new sexual relationship. Some patients report difficulties with getting job interviews, which can affect their career choices. In one international study, more than 40% of adults with vitiligo reported that they believe vitiligo has held back their career. Race and ethnicity also impact how a patient experiences vitiligo, with those with darker skin tones experiencing a higher burden on their quality of life. There's also a relationship between culture and the burden of vitiligo. As examples, in some cultures, vitiligo may affect marriage prospects, and in some places, vitiligo may be confused with leprosy. Vitiligo may also be misunderstood as a threat to a patient's racial identity, with patients of darker skin tones facing more stigma around vitiligo, as it's more prominent on their skin compared with fairer-skinned patients. There's a clear need for more education on the true impact of vitiligo on patients' lives and work. By recognizing the varied and far-reaching psychosocial aspects of vitiligo, healthcare providers can give empathetic care and help improve the overall well-being of patients living with vitiligo. To learn more about vitiligo comorbidities and how it can also affect patients physically, check out the other video in this series entitled Unmasking Vitiligo, Understanding the Physical Burden and Comorbidities of Vitiligo.